Good afternoon. Welcome to today's Wisconsin Health News Newsmaker event. We are thrilled to have Senate Majority Leader Devin LeMahieu with us today. Senator, thanks so much for taking this time to be here today. Thanks to all of you for tuning in. My name is Tim Stum. I'm the editor of Wisconsin Health News. Before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News Newsmaker series. These important discussions would not be possible without their support. So a huge thank you to Anthem Blue Cross and Blue Shield of Wisconsin, Deloitte, Froedtert and the Medical College of Wisconsin, Husch Blackwell, United Healthcare Community Plan, Bunbreezen and Roper, and the Wisconsin Hospital Association. Thanks also to Badger Bay Management for hosting these virtual events in partnership with Wisconsin Health News. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial. You can sign up on our website at wisconsinhealthnews.com or through the event evaluation, which we'll email out after today's event. An extra thanks today to Anthem Blue Cross and Blue Shield of Wisconsin, today's featured sponsor. We are very grateful for all of their very generous support. And thanks again to Senate Majority Leader LeMahieu for being here. It's a busy time of year as work continues on the state budget and the spring legislative session winds down. Our time is limited, so I really just want to dive into the questions. And Senator, I guess we should probably start with the big news of the day. The Nonpartisan Legislative Fiscal Bureau said in a report this morning that they expect general fund tax collections to be $4.4 billion more than their January estimate. I know you're probably still digesting the enormity of that, but what could that mean for healthcare items in the budget?
I think it definitely makes it easier for us to make sure that we're investing in healthcare, to make sure that we continue Wisconsin's excellent quality that's provided in healthcare, and just to make sure we make those investments in different areas to continuing on our last couple budgets to invest in long-term care facilities, hospitals, and things like that.
And as this spring session winds down, what are some of the caucus's remaining legislative priorities for healthcare?
That's one of the big areas of the budget that we'll be taking up sooner rather than later. And I think, we'll be focusing on a couple different areas. I think first we'll look at the healthcare stability plan that was started under Governor Walker to make sure that those on the individual market can make sure that they have an affordable option to buy health insurance. That plan seems to be working very well. New providers have entered the field in some areas of the state, and enrollees have increased. So we'll be making sure that we look at that to make sure that there is that affordable option for small businesses, for Main Street businesses. We'll be looking at, dish payments for hospitals again to make sure that they can continue to provide the services they're providing, and likely look into, like I mentioned last budget, investment in long-term care facilities, IRIS, things like that, just to make sure that we can make sure that these agencies can continue to hire people, so that way we can provide the quality care, or these organizations can continue to provide the high quality care that they have been providing in the past. And one thing that will,
yep.
Oh, go ahead.
No, go ahead.
And one thing that we need to consider in the DHS portion of the budget is for MA, there's about $650 million cost to continue that we'll also be taking up.
Okay, great. It sounds like a long list of stuff still to tackle. Kind of sticking with the legislative session for a minute, and then I do want to talk a little bit more about the budget. Assembly lawmakers introduced proposals last week that would prohibit COVID-19 vaccine passports, bar discrimination against people because of their vaccination status, and stop the University of Wisconsin system from mandating COVID-19 testing. Are these things that Senate Republicans support?
We haven't caucused on them as a group. I think there is interest in our caucus to make sure that people aren't required to get a vaccine. That's a personal health decision that people should be able to make on their own. But I'm not sure if we need to send these through the legislative process, or if we will at this point. But I think it's extremely important that people have the right to make their own health decisions and what suits them best.
So these are somewhat in the same vein as COVID-19 vaccine bills that the governor previously vetoed. Health groups, including the Wisconsin Medical Society, are opposed to these new measures. Their head lobbyist testified last week, quote, "Those whose lives are most endangered by COVID-19, the elderly and patients with compromised immune systems or other conditions, deserve to have access to healthcare services and facilities where precautions have been taken against easily spread viruses." End quote. How do you respond to that? I mean, many healthcare facilities require flu shots, at least for their employees. Why shouldn't they be allowed to ask about COVID-19 vaccines?
That's obviously a decision that can be made right now by that healthcare facility, but the residents at these facilities certainly have the ability to get the vaccination themselves, and hopefully that protects them.
So earlier this spring, Wisconsin was among the nation's leading states in terms of its COVID-19 vaccination rate. It's now quickly slipping towards the middle of the pack. What, if anything, should be the legislature's role in not requiring but promoting COVID-19 vaccines?
I think the state's done a decent job of making vaccines available all around the state. So, and there's been it's hard to turn on the radio or TV without seeing PSAs about the importance of getting vaccinated and protecting others. So it's like I mentioned earlier, it's obviously a decision that each individual has to make whether or not it's important for them to get vaccinated. It's available, and I think we're at a point where hospitalizations are at an all-time low since the pandemic started, and we continue to see people getting vaccinated. So that's a good thing. Cases continue to drop, and for my travels around the state, it's been great to see things starting to return back to a sense of normalcy as we enter the summer.
So other states, Republican and Democratic led, are starting to increase incentives for COVID-19 vaccine take-up. This includes lotteries, free beer. West Virginia is even offering free guns. Would you support using any state money for any incentive program like this?
Unfortunately, the way the federal money has been given to states, the executive branch has the vast majority of the control over that federal money. So that, I guess, would be up to the governor to decide that. I don't think it'd be prudent for us to use state GPR for purposes like that. I'm always up for some free beer myself, but I don't know if that's necessarily the role of using state collected taxes when the governor of Wisconsin is sitting on a large pot of money that he can use, and that's supposed to be used for COVID-related activities.
So you would support him using that money for something like that?
Yeah, I mean, that money can be used for, like I mentioned, PSAs, things like that, to show the importance of getting vaccinated and following CDC guidelines. But it's really up to the governor at this point. He sort of boxed us out in those talks.
So a key holdout group for vaccine take-up is residents that do tend to vote Republican, especially Republican men. Do you feel like you, as a Republican man and someone who's in a leadership position, that you personally could or should do anything more to reach this constituent group? Like, would you, for example, ever participate in a PSA like Speaker Voss did for masks?
Well, I think at this point, I don't know if there's a need for people to actually be wearing masks, because that's following CDC guidelines.
No, sorry, not about masks, but about vaccines.
Oh, I think the vaccine's available. I think it'd be great if people get vaccinated, if they're comfortable with that. And I haven't been asked, but I would consider it depending on who asked me. Sure.
Have you gotten your COVID-19 vaccine?
I have not yet. I had a Ironman triathlon just recently, and
nice.
Didn't want to mess with my training during that. So that was only a couple weeks ago. So I haven't had an opportunity since then yet.
Okay. How did you do in the Ironman?
Finished.
Nice. Congrats. So let's shift to the budget. What is the latest on the budget process? I mean, do you think that this will get done on time? Do you think lobbyists and lawmakers can start to safely schedule July vacations?
I hope so. I'm ready to vacation in July, but we're on schedule to get it done by the end of next week. That gives the Fiscal Bureau and Reference Bureau a week or so to get it drafted into bill form, and hopefully our plan is by the end of June, by June 30th, to have the budget passed. And the new numbers this morning, as you referenced at the beginning of this, does obviously give us more things to consider in the next week and a half, 2 weeks. But I think I'm confident that we can come to an agreement with the Assembly and provide the governor with a good piece of legislation that invests in the state in very many important areas, but also provides crucial tax relief.
And when do you think, you mentioned a long list of stuff that could fall under the Department of Health Services? When do you expect that DHS will come up to JFC?
I believe that's on the schedule for Thursday this week. So today they're meeting, and then they're meeting again on Thursday, and that's when I anticipate that will take up a lot of that department.
Great. And what role should the legislature be playing? And you've kind of talked about this. Maybe you could talk about a little bit more. What role should the legislature be playing in helping the state recover from the COVID-19 pandemic? I mean, do you see a role for that in the budget with state dollars?
Like I mentioned previously with, vaccines and PSAs and things like that, the governor has been given a large sum of money to deal with the pandemic. Also, local levels of government have also gotten direct payments, very large payments to counties, municipalities, school districts, universities. So I think that money is designed to help deal with the pandemic, and the best thing that we can do in the legislature is pass a responsible budget providing tax relief. It's been a rough year for last year was a rough year for a lot of small businesses, families, things like that. So anything we can do to help them out financially, I think that continues to keep our economy growing, getting people back to work, and sort of returning to a sense of normalcy.
So the governor has somewhat outlined where some of the more than $2 billion coming to the state from the latest COVID relief package is going to go, some of his priorities for that. Has he talked with you about any more specifics on that? I mean, do you have any more details about where some of this federal money is going to go, and how is that impacting how the budget is crafted?
We haven't, the governor hasn't reached out to my office in quite some time. And he pretty much made it clear that he didn't need to work with the legislature in spending this money. So what your organization knows is pretty much what my office and I know regarding the matter. So we can't focus on how the governor is going to be spending his money because he's not engaging us in the process. So we have to look at the budget, what we can do with the budget, and make sure we're making prudent investments in areas that we can control.
So the Joint Finance Committee delayed action on broadband after the governor did announce $100 million for it from the COVID-19 relief funds. Can you provide any clearer picture about what your caucus supports in terms of broadband expansion?
Yeah, we're looking at making an investment in broadband yet, hopefully in this budget using GPR dollars. And our focus is going to be some of the challenges with the federal money that can be used for broadband is some of the federal strings that are around it. So it may not hit that last mile of unserved area. So I think what we're looking to do with that, whatever kind of GPR we put into the budget for broadband, is to make sure that it's actually hitting that last mile of unserved area rather than boosting speeds and underserved area and things like that, which maybe the federal money is more suitable for. Obviously, it's still hitting some unserved people in that area as well. But if we're going to make a GPR investment in broadband, we just want to make sure that it's hitting that last mile, which isn't economical for companies to move in from. And I think that's the most important role of broadband expansion.
So the Joint Finance Committee, also, as you highlighted in a recent constituent newsletter, recently voted to increase funding for school-based mental health. I know this has been a big priority of yours, and the committee included meeting the governor's proposal for school-based mental health collaborations grants. Can you talk about just a little bit more about why this is important and what are some of your other mental health priorities in the budget?
Sure. Actually, my first session, I actually had a chance to work on bringing down some of the barriers to bring mental health into schools. Worked with Representative Tittle on that bill, the mental health chair in the assembly, and we think that's been a successful bill to make sure that schools can, bring people in part-time to provide those services on site. But as I mentioned earlier, it's been a tough year in a lot of people this last year, being shut down for 2 months, schools being shut down even longer in some instances. So we've seen an impact in crime and mental health issues, depression, things like that. So yeah, I think mental health is an area where you can truly make a difference, especially during a tough year where people were maybe socially distanced from their friends, isolated, maybe feeling isolated, and any type of help we can provide in that area is definitely important to make sure that people can get kids especially can get the help that they need.
Sounds like this is an area where there could and likely would be bipartisan support. What are some other healthcare items that you think realistically there could be some bipartisan support for in the budget?
I think the vast majority of the health items will have bipartisan support. Sometimes we may bicker over how much that dollar amount should be, but investing in long-term care facilities, investing in IRIS, things like that, dish payments for hospitals. I think those are all very important things to mental health services. In a lot of those areas, in the previous budget, the governor had proposed making some pretty big investments in health areas, and we actually passed a budget that went above and beyond in our previous budget. And I think we might be somewhat in the same position again. So hopefully, I think health is an area where there may be some disagreements on how to get there, but ultimately we want to make sure that especially those who need it most can get the coverage they need.
Senator Coenga said at a somewhat recent Joint Finance Committee hearing that he sees Medicaid expansion as, quote, ripe for agreement between Democrats and Republicans. Statements that you've made on the topic do not quite indicate a similar stance on that. How much support is there in your caucus for any type of agreement on Medicaid expansion? I mean, do you see any type of compromise possible on this?
At this point, our caucus is not in favor of Medicaid expansion. Wisconsin has very good health care. We're typically ranked in the top 3 in quality of healthcare services provided. So especially, or maybe top 5 in quality of healthcare and access to healthcare. So, we have a very good system in place right now. We're focusing on things like reinsurance, investing in the healthcare stability, dish payments to make sure that, hospitals can afford to serve those who are on government assisted health plans. But, by exacerbating the problem by throwing an extra 45, and we really have no coverage gap in the state of Wisconsin, especially with this new ARPA bill that passed the federal government. The silver plan now has no premiums for people in Wisconsin for the next couple of years. So especially right at this point, it doesn't seem to make any sense for us to do Medicaid expansion in the state of Wisconsin. And we'll continue to make sure that we're making the investments we need to so that everybody has the ability to get an affordable plan.
So you, in a letter sent last month by yourself and other GOP leaders, listing a lot of the reasons that you just listed, you actually called the governor's Medicaid expansion proposal, quote, reckless. What's different, this budget, of course, compared to previous attempts to expand Medicaid, is that this latest version includes from the federal COVID-19 relief package an additional $1 billion that Wisconsin could save by expanding Medicaid, meaning the state would now save $1.6 billion over the next 2 years by expanding Medicaid. Isn't it reckless not to take that kind of money for the state?
That money is only good for a couple of years. It's going to go away at some point. And I think we have enough money right now in the state to pass a responsible budget. We saw that this morning. So just to, expand government assistance, put more people dependent on the government isn't necessarily the best idea when we're trying to get people back to work, trying to grow our economy, trying to make sure that we have high quality healthcare in the state of Wisconsin. So, I think we've done a great job making sure there isn't a coverage gap, making sure that everybody who wants health insurance can get it. I think I'm going off the top of my head now. I didn't look this up, but I believe this is correct that out of the states that haven't taken Medicaid expansion, we have the lowest amount of uninsured people of any state in the nation. So, we do healthcare right here in Wisconsin. So, just fundamentally changing how we operate here in Wisconsin I think is a mistake.
So GOP lawmakers proposed a $1 billion in property tax relief with the federal COVID-19 relief funds that the governor proposed. So why not just expand Medicaid and use the $1 billion for property tax relief?
I'm not sure if that's how it works, but that's certainly an idea. That was an idea maybe driven by the assembly to provide that property tax relief. I think as we go through this budget, we'll maybe be looking at more of different areas to provide tax relief to Wisconsin citizens, maybe not that heavily focused on property taxes. We've done a good job over the last decade of holding the line on property taxes, but I think there's some other areas where we can address, such as income taxes and personal property tax and things like that.
So as you point out in your letter, and as you've pointed out today as well, by expanding Medicaid, it would add about 90,000 people to the Medicaid rolls. About half of these people are currently on subsidized coverage through the Affordable Care Act. But the other half, roughly about 40 to 45,000, currently don't have coverage. What efforts, if any, would you support to try to reach these people and make sure that they do get healthcare coverage?
I'm not sure what efforts would be available, but I think, as I mentioned earlier, all those are eligible right now for free healthcare coverage under the Silver plan. So, it's available for them if they're interested. I'm sure they can find a way to figure that out if they go talk to a healthcare provider or an insurer of some sort. I would think they'd be given that option. So, it's available.
So would you provide would you be in support of, for example, additional outreach efforts to make sure that people are aware of their coverage options to help reduce that uninsurance rate even more for Wisconsin?
I think that, if I'm not mistaken, I think that does go on every fall during the eligibility period. So that I believe that is being done already.
Healthcare providers are also pushing for extending postpartum care in Medicaid. Other Republicans have showed some support for that. Is that something that you or your caucus would support? Why or why not?
Yeah, we've had a couple caucuses recently on looking forward to what we're going to do in health, and there was a lot of interest in this area in our caucus. So I'm hopeful that we can get it done in the budget. We'll see where we come at on Thursday, but yeah, there seems to be a lot of interest to make sure that new moms have the support that they need at this time. So I think it's very important to some members of our caucus, and I think we hopefully can get that done.
So you mentioned long-term care issues. Providers of long-term care are seeking tens of millions of state dollars for rate increases. Do you anticipate meeting these requests?
We're still working through the motion that we're going to do for health, and I think it's going to have a lot of great things for the industry, for healthcare, and for those who are maybe struggling to afford healthcare. So I think overall we'll provide a good product. I'm not sure what's going to all be in that motion, but I think it'll definitely be something that will interest the governor to sign the budget.
Governor Evers did recently say that a full veto of the state's budget is not off the table. He specifically raised concerns about the size of the Department of Public Instruction's budget and whether it would jeopardize federal funding. What is your reaction to that statement about a veto? I mean, how are GOP lawmakers taking a potential veto into account as they craft their budget?
We can only do what we can do in our end and provide a responsible budget. Noticeably, he didn't say he was going to veto it yet, so that's a good thing. I think it'd be the best thing is if we can get a budget signed for the state of Wisconsin to provide that type of stability for the next 2 years. But we're, outside of the budget, K-12 education has received, I believe, about $2.6 billion through all three of the federal programs. So I think it's great that we stuck an extra 128 million, if I'm not mistaken, into that as well. But since the governor doesn't seem to see the need to meet with us and talk about his priorities other than issuing a budget at the beginning of the process, we will go through and do what we think is important. And hopefully, like 2 years ago, the governor sees the wisdom in the budget that we provided and he signs it. And that's ultimately our goal, is a signed budget and a responsible budget for the state of Wisconsin.
So things are a lot better than they were 15 months ago when we did our first virtual event for Wisconsin Health News. But I still want to end today's event as we are quickly running out of time. And I know we got a hard stop today at 12:30. But I still want to end today's event with the same question that we've ended a lot of these virtual events. And that is, Senator, what are you most optimistic about right now in terms of Wisconsin healthcare and the health of our state?
I think, as I mentioned, a couple different times during this half hour, it's great that Wisconsin is consistently ranked in the top 5, typically top 3 in quality of healthcare. That's exciting. That's great. It shows how hard our hospitals work, how hard our healthcare providers, the services they provide, the climate in the state for healthcare providers, and that's something that we should be proud of in Wisconsin, that we have, so many great hospitals, so many great organizations that are actually located in Wisconsin that provide insurance. That's something to be proud of and something that we need to make sure continues in the state of Wisconsin and needs to be protected.
Well, Senator, thank you so much. This has been a great discussion. We've gone over a lot. We really appreciate you taking the time. Thanks to our generous sponsors for making this important discussion possible. And thanks to all of you for tuning in today.
Thank you.
Thanks.